Diabetic cats must eat regularly in order to maintain safe blood glucose concentrations. If your cat doesn't eat, giving him insulin could result in a dangerous drop in the blood glucose concentration. This is known as hypoglycemia and occurs when the glucose drops below 80. Severe hypoglycemia, or insulin shock, deprives the brain and other vital organs of glucose and can result in seizure, brain damage, coma, or death. To help protect your cat from hypoglycemia, you will need to monitor his appetite daily. If your cat's appetite is diminished or if he stops eating for any reason, do not give him an insulin injection until you contact your veterinarian. Even with careful monitoring, hypoglycemia can still occur. Some cats lose their need for insulin injections without warning. Sometimes you won't know your cat no longer requires insulin until an injection lowers his blood glucose below 80, at which time you may notice the signs of hypoglycemia. The signs of mild hypoglycemia are weakness and lethargy. Your cat may seem sleepy, reluctant to move, or may be slow to respond to you. If you notice these signs, you should immediately give your cat about 1 tablespoon of Karo syrup in his mouth to help raise his blood glucose level. Using a syringe or eyedropper, slowly squirt the syrup into the mouth, giving your cat time to swallow. Do not put your fingers directly into your cat's mouth. Hypoglycemia can make your cat disoriented, and you could be seriously bitten. Next, try feeding your cat. Offer him something he really likes, like canned cat food, baby food, or maybe tuna fish. In most cases, you should see signs of improvement within 10 to 15 minutes. Once you've treated your cat with syrup and food, call your veterinarian for instructions before resuming the insulin therapy. Unlike mild hypoglycemia, severe hypoglycemia is a medical emergency that must be treated aggressively by your veterinarian using intravenous glucose. The signs of severe hypoglycemia are unmistakable and require swift action on your part. If your cat is dull and unresponsive, has a head tilt or uncoordinated gait, is exhibiting bizarre behavior, or is seizuring, call ahead to your veterinary hospital, then proceed immediately to your veterinarian or the closest emergency hospital for treatment.
Because we've had him go through all kinds of ups and downs. They can be well, so well, and then in 2 hours be so ill. So it was almost an overnight change in the cat. And I noticed that he had gone outside of his litter box. He had defecated outside the litter box, and that's not usual for Spike. And I noticed he was staggering and seemed very disoriented. I had run to the kitchen. I found you have sugar on it, something, you know. I had syrup, which was, he loved it, and they don't usually like that. So we got him to where he seemed to be cognizant of what was going on. And got him right to the vet, and they kept him during the day, and they measured his blood glucose during the day, and we got him back to normal. So those things happen, and I think people need to know not to be extremely panicked about it, but to always be vigilant.
With careful monitoring and frequent veterinary checkups, your cat may never experience a hypoglycemic episode. If an emergency does occur, however, being properly prepared can save your cat's life. Have all the necessary supplies on hand for quick use should the need arise, and make certain that you and everyone in your family knows the signs of hypoglycemia and knows how to respond to a hypoglycemic crisis.